actually be doing something to prevent heart attacks? Researchers say the answer is yes to that question. They found that potassium-rich foods may stop fatal blockages by keeping the arteries flexible. The nutrient is thought to regulate the genes that help to maintain artery flexibility as well. Past research actually suggested stiff and flexible arteries led to heart attacks and strokes. Amy.
All right, thank you, Ryan. Today's Healthy Living House Call sponsored by Florida Hospital. October, of course, Breast Cancer Awareness Month. The annual campaign is designed to raise awareness of breast cancer risk and the importance of screening and early detection. And joining us, our good friend, Dr. Olga Ivanov. She is a surgeon with Florida Hospital. Always great to see you. Thanks for coming back to visit us again.
Thank you for having me, Amy.
So let's talk first about mammograms. So important. We had a woman on just an hour ago who, at age 39, had never had a mammogram, but found a lump and knew she had breast cancer. We talk about this all the time, the importance of mammograms. What are your thoughts?
There's different school of thoughts out there. Different physicians and societies give different recommendations, but I think still the party line, the hard rule is at the age of 40, once a year, up until the woman is active, don't stop.
Right. And of course, if you have a family history or any prior issues, you should always go earlier, right?
Always have an educated talk with an educated physician about this issue and customize your plan. We're not all the same, so we should not all the same have the same 40 years old and annual plan. We should have a customized plan.
Right. Okay. What about some long-term issues that women experience? So we have a lot of breast cancer survivors in this country. What other issues do they oftentimes deal with?
So that's a perfect point. I think we do talk a lot about early screening, early diagnosis, and that just shows that we are doing something. You know, me coming here every year and talking about mammograms, us talking about this every October, does increase the amount of women that we find at earliest stage, and women who are found at earliest stage of diagnosis are more likely to survive long-term, full life. Now we are really shifting as cancer surgeons, as cancer scientists, into looking as to, okay, so what happens to a survivor afterwards? Many times these women say, you know, I've gone so mutilated on so many levels, physical and emotional, through the treatment that is this life even worth saving at this point? So we do have some good news there. There's a lot of non-hormonal options that we can provide to women with long-term side effects from surgery and from hormonal medications that are really helping them in rejuvenating and feeling their best, and many times not just resetting to where they were prior to cancer diagnosis, but making a new, better life for themselves afterwards.
I love to hear that. And as far as new treatments on the horizon, I imagine they're always working on things.
Every 6 months there's something new, seriously. One of the examples that I always like to quote is intraoperative radiation therapy, where a woman, instead of 33 daily treatments, has to only have 10 minutes during the time of the operation of radiation, and basically never has to experience what radiation feels like.
Okay, well, I know our viewers are going to have a lot of questions for you. She's going to be sticking around. That's what's so great, to answer your questions. So if you have something you would like to ask Dr. Ivanov, simply go to our website, fox35orlando.com/health. We'll have a little banner on there. You just click on that, and we're going to check back in with Dr. Ivanov a little bit later to see what types of questions she's been getting. Great to see you as always. Thank you so much for being with us again. All right, 9:18.